Good morning. Welcome to the Bryan Press Briefing on Tuesday, July 14th. I'm John Woodrich, CEO of Bryan Medical Center. Today we have a guest, Kelsi Anderson, who is the provost of the Bryan College of Health Sciences. And she's going to give you some information about what we're going to be doing as we have additional patients come in this fall. Wanted to share with you some numbers. Our midnight census is 433. We have tested just shy of 15,000 patients now. We have 1,789 positives and 437 still pending. So we've talked a lot about our pending because we've been using an outside lab. They have started to get a little bit better on the turnaround. We're down to about 3 to 4 days. Really a nice reduction. We were seeing as long as 7. So we continue to monitor that closely. We are seeing the testing increase a little bit as well. More people are presenting. And I think you'll see some of the numbers are starting to increase even from an inpatient perspective. And this is something that we've talked about for quite a period of time, that we believed we would see another bit of a surge occur. So I will share with you our other inpatient numbers. We now have 9 positive COVID patients in-house. 8 of those are from Lancaster County, 1 from outside of our county. We have 3 others that are pending that are in-house as well. We still have only 1 of those individuals that is on a ventilator, and that's good news. So we have 1 in our intensive care unit, 3 in our progressive care unit, and 5 in our general care unit. I thought I would also just talk about next week. So we have a couple guests next week, Dr. Stephen Russell, who is a pediatrician here in town, who will be just sharing information with parents who are having those questions about what should I be doing for my child if they're going to be involved in activities and other things. So he will share some inside information with you. And then on Thursday, we will have Dr. John Stoiter, who is a cardiologist, and he will talk about athletes returning to workouts, and especially if they were COVID positive previously and are now negative. So he will share some of that information with you. With that, I'm going to ask Kelsi to come forward, and she'll share information about the college reopening.
Thank you, John. Well, good morning, Blue Healers. My name is Kelsi Anderson, and I am the provost of Bryan College of Health Sciences. Since my last update, we saw a decline and then a subsequent increase in statewide cases of COVID-19. However, this increase is nowhere near the level that some other states are seeing. So please continue to do your part to lessen the number of new infections, including wearing a mask and social distancing. Today is my second of 3 updates related to our fall semester plans. We have now posted 2 scenarios on the records and registration website, one representing classes being delivered in an online or remote format, and the other with classes in each major being delivered face-to-face, with general education courses being taught remotely. And there will be some exceptions to that. Our final decision will be delivered in 2 weeks on August 1st, but given current conditions and guidance, it does look like we will be able to follow our plan for a mix of face-to-face and remote and online classes. Regardless of how lectures are delivered, all clinicals and labs will resume in the face-to-face format. Later this week, we will distribute a guidebook with pandemic-related information and procedures that our students and staff are expected to follow. No matter the teaching scenario that we choose, masks will be required of all people present in all college buildings. Our final decision for course delivery will occur on August 1st. As a reminder, student class schedules will be adjusted automatically by our records and registration teams to accommodate smaller face-to-face class sizes due to multiple sections. No matter our decision, we will continue to plan for high-quality course delivery with or without the resurgence of COVID-19. Please do not hesitate to contact me via phone or email if there are any other questions or concerns that you have. Thanks so much.
So we have a variety of ways that you can get tested. As we have stated in the past, you can go through our drive-through. That is one way of getting tested. If you are sick to the degree that you're having high fevers and difficulty breathing, we would recommend that you utilize the emergency department. We don't want everybody coming there that may just have some mild symptoms of it. That's what the drive-through, and even our urgent care center. You can go to the urgent care center. It's open 7 days a week, 8 to 8. So far, from a testing perspective, we have not had people max out the time periods that were open from for our drive-through and in our urgent care center. So there are spaces available if people feel that they need to get tested if they're showing any of those signs or symptoms. My understanding is Test Nebraska's turnaround has been about 2 to 3 days. I know for quite a period of time they were turning around in about 2 days, but they have seen a significant increase as well in the number of individuals getting tested. And it's no different than the third-party labs that we use to send out to. As you watch spikes occur in different areas, they just see larger volumes, and it's trying to adapt either from an analyzer perspective or from a staffing perspective to turn around these tests. I will let you know, all of these companies and organizations that are working on this are doing this testing around the clock and resulting. So I know they're opening up additional ones. Just as I mentioned to you last week, we're starting to send tests to Kansas City. So there's a variety of different locations we're trying to utilize to get the turnaround as quickly as we can. We know that's difficult for people. One, they want the results. But two, if they're having those symptoms, what do we recommend is that they quarantine themselves. So the longer that they have to wait and be waiting 3 days or 4 days or 5 days, we know wears on individuals. So I know these companies are doing the best that they can at this point in time. And as I have stated in the past, if we could get the Cepheid test, which is the really quick turnaround in about an hour to 2, or the Luminex test, we can turn around in 6 to 8 hours. It's a supply and demand issue. And if we can get our hands on that, we could sure do a lot more here at Bryan. I think it's what we've continued to talk about. Are you continuing to social distance? Are people wearing masks? Are they washing their hands? So I know it's a real difficult and maybe mixed message to people. As government officials and everybody is trying to open things up again, they're trying to do it in the most prudent way. I think sometimes people may take that message as it's okay, and it's really not still. We're trying to normalize things the best that we can, but you still need to mask and wash your hands and do the social distancing. And I know it is inconvenient as you start to get together and people like to eat and do those types of things and you're taking your mask off. Look how close you're standing next to the person. Think about the food that you're around. Are you handling food that is already pre-packaged versus reaching into a bag of chips with multiple people? Those are the things that we need to do to stop this surge from becoming, I would say, out of control like you've seen in other areas. And I think we've shown here in Nebraska that we've been able to flatten that curve and listen to our officials appropriately, and that's what we need to continue to do. I think right now I have not seen us hit our maximum from a testing perspective. If we get to that stage, then I think we need to look at other alternatives, but we can accommodate people for testing currently.
So as I was reflecting upon this question this morning, I have a few points that I wanted to emphasize. So the first one, the result of this will obviously be groups gathering like we haven't done for the past 4 or 5 months. So class sizes, 30 or so students. We're working at the college to make sure that we're only using our classrooms to 50% capacity so that we can distance our students and have them wear masks. And I know that many other colleges are doing that as well. Some things that we'll have to consider are ways to manage the fear and anxiety of students, parents, and faculty who have really gotten used to isolating and feel safest in isolation. And now they're going to be back around groups again. So we have personnel at our college who will help students work through those feelings. Having flexible and adaptable policies in place to deal with the unexpected but predictable infection of students or faculties when they occur. So how are students going to be engaged in the classroom if they're quarantined for 14 days? How will faculty be able to deliver content if they themselves are sick or quarantined, if a substitute isn't available? And what toll will it take on students to be quarantined or knowing that their teacher is sick? That could promote some fear and anxiety as well. And finally, I think that prevention measures will need to be maintained at school. So we are requiring masking, hand sanitizing in and out of the classroom, disinfecting wipes available. But we are also going to need to trust each other that we're also maintaining those prevention measures in the community, so masking and social distancing. So it's that mutual trust, I think, that's going to establish a really successful educational environment in the fall for both teachers and students and parents.
I have not looked at that data specifically, but I will tell you what you're hearing nationally and as well as locally is that you're seeing a younger age or population testing positive. So when we think about this and you have what you call the relatively healthier individuals coming down with this, that as time goes on, we're hoping they then just don't pass it on to maybe the parents, the mother, the father, or the other elderly, because we will start to see that surge continue when that occurs. So it is a concern of ours as you watch more of the younger people be diagnosed with this virus. Generally the same day. If you call the drive-through and it's later in the day where they've already completed, then you'll probably get scheduled for the next day. Urgent care, you can just arrive there. So it's 8 to 8, 8 in the morning till 8 at night. You can be seen the same day.